Vitamin B12, also called cobalamin, is one of the most important vitamins for maintaining good health, yet it is also one of the most commonly overlooked. Unlike some vitamins that the body can store in large amounts, vitamin B12 is water-soluble and depends heavily on continuous dietary intake or supplementation. It plays a central role in three life-sustaining processes: the production of healthy red blood cells, the synthesis of DNA, and the maintenance of the nervous system, including the protective sheath, myelin, that surrounds our nerves. A deficiency in vitamin B12 can therefore affect multiple systems of the body at the same time. In the short term, it may appear as simple tiredness or mild weakness, which many people ignore or attribute to a busy lifestyle. However, over time, low B12 levels can progress to cause serious anemia, irreversible nerve damage, impaired cognitive function, infertility, and even vision loss. What makes the condition particularly dangerous is that some neurological symptoms can develop even in the absence of anemia, meaning a person may look healthy in blood tests until the damage becomes advanced. Globally, vitamin B12 deficiency is a widespread health issue. Studies estimate that it affects up to 6% of people under the age of 60 and more than 20% of those over 60, with even higher rates in developing regions. Risk factors include strict vegetarian or vegan diets without supplementation, gastrointestinal disorders such as celiac disease or Crohn's disease, long-term use of medications like metformin or acid-reducing drugs, and age-related decline in absorption. Pregnant and breastfeeding women are also at risk, as deficiency in mothers can negatively impact infant growth and brain development. Because the early signs are often vague and mimic other conditions, such as fatigue, mood swings, or digestive issues, many people do not recognize the problem until it becomes severe. This is why awareness of the signs and symptoms is critical. Recognizing them early, seeking proper testing, and beginning treatment can prevent long-term complications and restore health. In this video, we will explore 15 detailed signs and symptoms of vitamin B12 deficiency, supported by scientific research, that should never be ignored. Each symptom reflects how this single vitamin affects blood health, the nervous system, mental well-being, and overall vitality. 1. Persistent fatigue and weakness. One of the earliest and most widespread warning signs of vitamin B12 deficiency is a constant feeling of tiredness and muscle weakness. This is primarily due to the role of vitamin B12 in red blood cell production. Without enough B12, red blood cells develop abnormally, they become larger, fragile, and fewer in number, a condition called megaloblastic anemia. These faulty red blood cells die prematurely, leaving the body short of oxygen-carrying capacity. When oxygen delivery to tissues is reduced, cells cannot generate sufficient energy, leading to overwhelming fatigue. A 2019 study published in the Journal of Hematology and Oncology found that up to 80% of patients with severe B12 deficiency complain of unexplained fatigue before diagnosis. Unlike ordinary tiredness caused by lifestyle factors, B12-related fatigue does not improve with rest or sleep. It can also be accompanied by muscle weakness, difficulty climbing stairs, or a lack of stamina during daily activities. If ignored, this fatigue progresses and interferes with quality of life, making early recognition essential. 2. Pale or yellow-tinged skin. Changes in skin color are another visible indicator of deficiency. People with low vitamin B12 often develop a pale complexion due to reduced red blood cell production. In some cases, the skin may appear slightly yellow, jaundiced, because the few red blood cells that are produced are fragile and break apart easily, releasing bilirubin into the bloodstream. Bilirubin is a yellow pigment that, in excess, gives skin and the whites of the eyes a yellowish tint. A study published in the British Journal of Hematology highlights that pallor and jaundice are early diagnostic clues for megaloblastic anemia caused by vitamin B12 deficiency. This symptom is sometimes so subtle that only family members or physicians notice it, but when combined with fatigue, it strongly suggests anemia. Importantly, jaundice due to B12 deficiency should not be confused with liver disease. It is reversible once the deficiency is treated. 3. Shortness of breath and dizziness. Since B12 deficiency reduces oxygen-carrying red blood cells, the heart and lungs work harder to compensate. This can lead to shortness of breath, rapid breathing, and occasional dizziness or lightheadedness, especially during physical exertion. Patients often describe feeling winded after climbing a few stairs or dizzy when standing up quickly. According to research in clinical nutrition, patients with pernicious anemia, a type of B12-related anemia, commonly report these symptoms. The lack of oxygen supply to the brain explains dizziness, while the strain on the cardiovascular system explains the increased heartbeat. In severe cases, palpitations and even fainting episodes may occur. Because these symptoms are similar to those seen in heart or lung disease, many people are misdiagnosed until a simple blood test reveals low B12. 4. Tingling, numbness, and pins and needles sensation, peripheral neuropathy. Vitamin B12 is essential for maintaining the myelin sheath, a protective fatty covering that insulates nerves and allows electrical signals to travel smoothly. When B12 is deficient, myelin deteriorates, leading to nerve damage. The result is paresthesia, a sensation of tingling, prickling, burning, or numbness, often felt in the hands, feet, or legs. What makes this sign particularly dangerous is that neurological symptoms can occur even in the absence of anemia, meaning blood tests may appear normal while nerve damage is already underway. A review in the Neurology Journal emphasized that peripheral neuropathy is one of the most common irreversible complications if B12 deficiency is untreated. Patients may initially ignore these sensations, thinking they are caused by poor circulation, but over time they can progress into permanent nerve injury. 5. Balance problems and difficulty walking. As nerve damage progresses, the deficiency can affect the spinal cord and cerebellum, which control balance and coordination. This condition, called subacute combined degeneration of the spinal cord, causes ataxia, unsteady gait, frequent stumbling, and difficulty walking in a straight line. Patients often describe feeling off balance or swaying when their eyes are closed, a classic sign of posterior column damage in the spinal cord. The American Journal of Clinical Nutrition has reported that older adults with undiagnosed B12 deficiency are at higher risk of falls due to balance issues. This is particularly concerning because falls in the elderly can lead to fractures and long-term disability. Unlike fatigue or pallor, which improve quickly with treatment, balance problems may take months to resolve, or may remain permanent if treatment is delayed. This makes early testing and supplementation critical once walking difficulties or unexplained falls are observed. 6. Cognitive changes and memory problems. Vitamin B12 is essential for healthy brain function. It participates in the synthesis of neurotransmitters and helps regulate homocysteine levels, which, when elevated, are linked with brain atrophy and cognitive decline. A deficiency can lead to confusion, forgetfulness, difficulty concentrating, and slowed thinking, often described by patients as brain fog. Several studies highlight this link. A large cohort study published in Neurology found that older adults with low B12 and high homocysteine were more likely to develop memory loss and cognitive impairment. Another review in the Journal of Alzheimer's Disease suggested that untreated deficiency increases the risk of dementia-like symptoms. Importantly, research also shows that early treatment with B12 supplementation can improve memory and focus, especially in older adults, though late treatment may not fully reverse the damage. 7. Mood disorders, depression, irritability, and anxiety. The connection between vitamin B12 and mental health is increasingly recognized. This vitamin helps produce serotonin and dopamine, neurotransmitters that regulate mood, motivation, and emotional stability. When levels are low, patients often experience depression, irritability, anxiety, or mood swings. A meta-analysis published in the Journal of Psychopharmacology found that low B12 levels were significantly associated with depressive symptoms, especially in older populations. Another clinical trial showed that patients with low B12 responded better to antidepressant treatment when B12 supplementation was included. This suggests that in some individuals, mood disorders may not only be psychological in origin but also linked to nutritional deficiencies. 8. Glossitis and mouth ulcers. Glossitis, or inflammation of the tongue, is a classic symptom of vitamin B12 deficiency. The tongue may appear red, swollen, and painful, with a smooth surface due to the loss of papillae, taste buds. Patients may also complain of a burning sensation, mouth ulcers, or difficulty eating and speaking. The British Dental Journal identifies glossitis as one of the earliest oral signs of deficiency and a strong diagnostic clue. Because the tongue regenerates rapidly, B12 is needed to support its constant cell turnover. Without it, the tissue becomes inflamed and sore. In some patients, this may be the first visible symptom even before anemia develops, making it a valuable sign for dentists and doctors alike. 9. Digestive problems, appetite loss, and weight loss. Vitamin B12 deficiency does not just affect the blood and nerves, it can also impact the digestive system. Common gastrointestinal symptoms include nausea, constipation, diarrhea, abdominal bloating, and loss of appetite. In more severe cases, unintentional weight loss may follow. A review in the World Journal of Gastroenterology notes that digestive issues are particularly common in individuals whose deficiency is caused by pernicious anemia or gastrointestinal disorders such as celiac disease, Crohn's disease, or after bariatric surgery. This happens because these conditions damage the stomach lining or intestines, preventing the absorption of intrinsic factor, a protein necessary for B12 absorption. Because these digestive problems overlap with other conditions, they are often misdiagnosed until a blood test reveals the true cause. 10. Blurred or distorted vision. In rare but serious cases, vitamin B12 deficiency can damage the optic nerve, leading to blurred vision, double vision, or decreased color perception. This condition, known as optic neuropathy, occurs due to demyelination of the nerve fibers responsible for transmitting signals from the eyes to the brain. Case studies in the Journal of Neuro-Ophthalmology have documented patients who developed vision problems due to prolonged B12 deficiency, with some experiencing partial recovery after supplementation. Although uncommon, this symptom is dangerous because if left untreated, it can result in permanent vision loss. Therefore, unexplained vision changes, especially when accompanied by other symptoms like fatigue or numbness, should always raise suspicion of B12 deficiency. 11. Headaches and frequent dizziness. Headaches are another common symptom of vitamin B12 deficiency. They often occur because oxygen delivery to the brain is reduced due to anemia, leading to vascular changes and nerve stress. Patients may also experience frequent dizziness or vertigo, especially when standing up quickly, as the body struggles to maintain oxygen supply to the brain. A study in headache, the Journal of Head and Face Pain, found that individuals with low B12 levels had a higher prevalence of migraine-like symptoms. Another review linked deficiency with orthostatic hypotension, a sudden drop in blood pressure when standing, which explains dizziness. While headaches can result from many factors, stress, dehydration, eye strain, if they are persistent and occur alongside fatigue or tingling sensations, B12 deficiency should be investigated. 12. Fertility problems and pregnancy complications. Vitamin B12 plays a vital role in reproductive health. In women, low B12 can contribute to infertility, menstrual irregularities, and recurrent miscarriages. During pregnancy, deficiency can increase the risk of neural tube defects in the developing fetus, preterm delivery, and developmental delays in infants. Research published in Pediatrics shows that women with B12 deficiency in early pregnancy are 5 times more likely to give birth to a child with neural tube defects compared to women with normal levels. In men, low B12 has been linked to reduced sperm count and motility, affecting fertility. Because of these risks, health experts recommend that women who are pregnant, breastfeeding, or planning pregnancy ensure adequate B12 intake through diet or supplements, especially if they are vegetarian or vegan. 13. Brittle nails and hair problems. Although less commonly discussed, vitamin B12 deficiency can affect the body's outward appearance. Many patients notice brittle nails, thinning hair, and dry or easily damaged skin. This occurs because B12 is necessary for cell division and oxygen delivery to rapidly growing tissues such as hair follicles and nail beds. Without adequate B12, these structures become weaker and more prone to damage. A review in the Journal of Dermatology noted that hair loss and brittle nails are frequently reported in patients with prolonged deficiency, often improving after supplementation. While these signs alone are not enough to diagnose deficiency, they may serve as additional clues when combined with fatigue, neurological symptoms, or anemia. 14. Severe psychiatric symptoms, anxiety, paranoia, psychosis. In advanced cases, untreated vitamin B12 deficiency can lead to serious psychiatric problems, including anxiety, paranoia, hallucinations, and even psychosis. These symptoms occur because B12 is essential for neurotransmitter balance and nerve protection. When levels are low, neurotransmission is disrupted, and toxic levels of homocysteine may accumulate, damaging the brain. Case studies in the Journal of Clinical Psychiatry describe patients who were initially misdiagnosed with schizophrenia or bipolar disorder but recovered after receiving B12 injections. While not every psychiatric case is linked to B12, this highlights the importance of considering nutritional deficiencies as part of mental health evaluations. Early treatment usually leads to improvement, but delayed treatment may leave lasting damage. 15. Developmental delays in infants and children. Vitamin B12 deficiency in infants is particularly dangerous because it can permanently affect growth and brain development. Babies born to mothers with untreated deficiency, especially vegan mothers who do not supplement, are at high risk. Symptoms may include poor feeding, irritability, weakness, delayed milestones, and developmental regression. A study in the American Journal of Clinical Nutrition stressed that infants with severe B12 deficiency may develop irreversible neurological damage if left untreated. Pediatricians often screen infants showing developmental delays for nutritional causes, and supplementation can lead to rapid improvement if diagnosed early. To prevent such risks, pregnant and breastfeeding mothers are strongly advised to ensure adequate B12 intake. Conclusion: Vitamin B12 deficiency is a silent but dangerous condition that can mimic many other diseases. From anemia and fatigue to psychiatric disorders and nerve damage, its effects are far-reaching. Key points to remember: get tested if you experience persistent fatigue, tingling, balance issues, or mood changes. High-risk groups: vegans, elderly, patients with GI disorders, pregnant women, long-term medication users, should monitor B12 regularly. Treatment is effective. High-dose oral supplements, 1,000 to 2,000 mg/day, work for most, while intramuscular injections are used for severe or neurological cases. Early detection is critical. Most symptoms reverse with treatment, but neurological damage may become permanent if diagnosis is delayed.